for having us. I'm here to talk to you about hearing loss, which is a bigger medical issue than a lot of people are aware of. If you do have a question, feel free. I'll address whatever I can. Some things might come along later in the presentation, but feel free to raise your hand. I want to give you information that you're looking for. So I already got a good introduction. This is Shannon Blake. Shannon is the audiology assistant at the office, also the receptionist, billing provider, and office manager. So you'll deal with her with lots of issues. So if you have a question, like I said, just get my attention. Hearing loss affects more than 48 million Americans. It's the third most common chronic health problem after just hypertension and arthritis. It affects approximately 1/3 of adults in their 60s, and a much larger percentage, over 80% of Americans that are 85 or older have hearing loss. I'm going to make sure this works. Okay. Hearing loss tends to be gradual. It comes on very, very slowly, and for that reason it can go undetected until it reaches a more advanced stage. But even at that point, it can be mistaken for other things. Some people just assume inattention, lack of care. They're not concerned with what you're talking about. Sometimes it's misunderstood for hearing loss or cognitive dysfunction. You know, we have that friend or spouse or parent that we think is starting to lose it. Sometimes it's really undiagnosed hearing loss. So common signs of hearing loss, it's not as obvious as some people think. A lot of times people will say, I can hear just fine, I just didn't understand. It's not clear. Or they'll say that they can understand everything except when they're in noise, and everybody has trouble in noise, so that's obviously not a problem. They also say, I do fine with everybody, it's just this one or two people. You know, it's just Sue, she doesn't talk plain. You know, I hear everybody else. There's reasons for that, and we're going to talk about that when we talk about hearing loss. A lot of times, people with hearing loss start to withdraw from social functions. So if you have a friend, relative who you see no longer interested to be involved in things that they used to find interesting, that can be a sign of hearing loss. And another one is just irritability. Hearing loss, as we're going to talk about, can be just exhausting. It's a mental overload on patients, so they can be very irritable, short on patients with their family. So let's talk a little bit about why this happens. Why do we have hearing loss? And in order to do that, I want to show you a little bit about the ear. So the ear is divided into three parts. You have your external ear, middle ear, and inner ear. And the external ear is what we're all familiar with. It's the ear that we can see, and our ear canal. The middle ear is this space here. It's air-filled, or should be air-filled, and it consists of the eardrum, these three little bones, which incidentally are the smallest bones in the human body. All three of them could fit on a dime with plenty of room to spare. And then this is the inner ear, which is this snail-shaped organ called the cochlea, leading to the hearing nerve, and then these are your three balance canals. So while I won't get into balance today, because that would be a whole nother discussion, this is why if you're having balance issues, you may have been sent for a hearing test or see an audiologist, because your balance canals are located in your inner ear. So when you have hearing loss, it could be because of a problem in any one of these parts of your ear or a combination. In the outer or middle ear, problems in this area are rare. This only makes up less than 10% of hearing loss, and it's usually medically treatable. So you could have just earwax, you could have a hole in the eardrum, you might have fluid in this middle ear space, or a problem with these three little bones where they get calcified and hardened and they don't start to move the way they should, or opposite of that, they can be all disarticulated or loosey-goosey. They're not operating the way that they should. When sound comes into the ear canal, it should hit this eardrum, and set it in motion. And the sound wave should cause these bones to sort of vibrate and carry the sound wave into the inner ear. So if there's anything blocking that conduction of sound, it results in hearing loss that we call a conductive hearing loss. Hearing loss in the inner ear is the majority of what we see with patients. A lot of people refer to it as nerve loss or nerve deafness, and there is no medical or surgical treatment for a sensory neural hearing loss or a hearing loss in the inner ear. Once you have it, you have it. And it can get worse. It usually does get worse. So where the conductive hearing loss is more of a medical type problem, sensory neural loss happens for a number of different reasons. One is aging. Unfortunately, that nerve is going to age just like every other nerve in our body. So we're all going to get some hearing loss due to aging. Now, how much we get and what age it starts depends a bit on our genetics, family history. So that will play a role in your hearing loss. It also depends on what we do to our own ears, noise exposure, for one. Men tend to have more hearing loss, more likely to have hearing loss than women. And for that exact reason is the noise exposure. They tend to have noisier jobs, both outside of the home or at home, mowing the lawn, weed whackers, chainsaws, and then sometimes every day around noise, depending on their career. So noise will damage the inner ear. When a loud sound, which is a very strong sound pressure, slams into the ear and hits this inner ear in here, it bends or destroys some of the hair cells that are in there. Sometimes it just bends them, so you don't get the immediate effects of noise exposure until years later when those hair cells die off earlier than they would have if they hadn't been damaged by noise. So you can, at your age now, be seeing some hearing loss that may have really come from noise damage, 20 years ago. This is what's hard for us with our young folks today. A lot of loud music, and it's hard to tell a 16-year-old that they're going to regret something later when there's no immediate consequence. Besides aging process and loud noises, there are diseases that can affect and cause sensory neural hearing loss. And some of these you may have a little bit of control over, and that's what we wanted to talk to you about today. Actually, let me show you this first. So when you come in for a hearing test, we're going to measure your hearing, and we're measuring different pitches or frequencies. So imagine this going across here like a piano keyboard. These are your low-pitch keys to your high-pitch keys. We want to see how well you hear at those different frequencies. Down the side is the decibel level or the volume. So the further down you go, that's the louder we were making the sound before you could hear it. So when we plot it, right here at 25 decibels, from that line and above is where we'd like to measure you. That would be normal hearing. A lot of patients with sensory neural or nerve hearing loss, because of the anatomy of the inner ear, get hearing loss just here in the high frequencies. So what that sounds like is, you can see all of these things on this chart. They hear all these low frequency sounds just fine. Car running, motor noise, these stronger sounds of speech like the E and the OO. But what they miss is the soft consonants. So the S, the T, the TH sound. When you make those noises, you realize they're a very soft, high-frequency sound. So when you have this type of hearing loss, you feel like you hear fine. Your sense of volume is okay because you're hearing the low frequencies okay. What you're missing is clarity. So that's why people will often complain, I hear fine, I just didn't understand what you said. You didn't enunciate. That is truly what it sounds like to them. And so they don't believe that they have a hearing problem. It's one of the reasons that hearing loss goes undetected for so long. The average person waits 7 to 10 years before their hearing loss gets significant enough that they decide to do something about it. And this is one of the main reasons, is it just fools them. Environmental noises like the birds and rustling of leaves, if someone's walking next to them is not pointing out that sound, they have no idea they're missing it. You don't know what you're not hearing unless someone else is telling you. So that's another reason why hearing loss tends to go undetected. So talking again about the causes, besides aging, genetics, and noise exposure, as I said, there are some diseases that do cause significant hearing loss. Diabetes is one of them. Diabetics are more than 2 times as likely to suffer hearing loss than those that are not diabetic. And studies show that it's for the same reasons that diabetics have vision loss or neuropathy. It can cause damage to the blood vessels in the inner ear. The inner ear has a very, very tiny artery that supplies blood. And it does not have what we call a redundant source. So a lot of places in the body have a second source blood supply. So if one sort of fails or has an issue, there's another source. That's not true of the inner ear. So if you have diabetes, if you have cardiovascular disease, hardening of the arteries, anything that's restricting blood flow or making you susceptible to small clots, and that happens to the artery that feeds your inner ear, you're going to be left with some hearing loss. So if you are diabetic or suffer from cardiovascular health, it's a very good idea another reason to keep that in as best check as you can. The inner ear artery is so small that sometimes we will see hearing loss before we've seen other signs of cardiovascular problems. As I said, with people with hearing loss, it hits the high pitches first. That's true for most aging, noise exposure hearing loss. Hearing loss caused by cardiovascular problems or blood flow from diabetes damage tends to hit the low frequencies, which is more unusual. So when we see with our patients a low frequency hearing loss, especially when it's new, we alert their physician and let them know that this could be an early sign of some cardiovascular problems. So it's another reason why having a hearing test is a good idea. It's not just to find out if you have hearing loss, but to make sure that there's nothing unusual in the pattern of your hearing that might give us a clue to other health problems that can be going on. And it's always nice to have a baseline, because it's hard to know later, how does this look different from what it would have looked like a year ago before you're experiencing these new symptoms. So there's the causes. So we talked about noise exposure, the natural aging process, hereditary, different illnesses, ototoxic medications. So there are medications that can be harmful to the ear and hearing. Over the counter, we do have a few that both over the counter and prescription, it's a tricky situation. A lot of times the medication is needed, and there isn't a lot that you can do about it, other than to be aware that it can cause either hearing loss or ringing or buzzing in your ears. So if I mention a medication that you're taking, you definitely want to talk to your doctor about it, but sometimes it's a matter of weighing the lesser of two evils. Over-the-counter medications, we worry a little bit about what we call the NSAIDs, or the anti-steroidal inflammatory drugs, like Motrin, Aleve, Advil. And I don't mean if you take one occasionally for a headache, but lots of patients with arthritis or back pain that are on heavy doses of those daily. And it can be a big cause of ringing in the ears. So if that sounds familiar, you may want to discuss that with your physician and see if there's an alternative. Certain reflux medications taken for gastroesophageal reflux disease have been linked with some potential hearing loss and ringing in the ears. And those drugs were originally meant to be used short term, but we're finding that patients are on them for a very, very long time. If you're noticing some connection with hearing loss and you take one of those, you may want to talk to your doctor about it. But the big ones that we really worry about as far as hearing loss goes are some heavy-duty antibiotics that are given intravenously. Usually when you're getting intravenous antibiotics, it's for a pretty significant infection. You can't do much about it, except to be aware that it might cause some damage to your hearing, and you may want to look into that after. There's some chemotherapy drugs that also are pretty poisonous to the ear, again, they're needed, but we do sometimes monitor the hearing to see if dosage needs to be altered. And then head injury, it can happen as well. So there's lots of causes. Most typically, we're seeing natural aging and exposure to loud noise. So how do we prevent hearing loss? Obviously, avoiding noise, taking good care of your health, and there's a few foods that have been found to help with many health issues, but including healthy hearing. And I think it's because these foods are known to help improve blood supply. But foods that are high in folic acid or omega-3 fatty acids. So if you like your green leafy vegetables and walnuts. We actually, it doesn't show it here, but Shannon and I know maple syrup has also been found. So if you're diabetic, not a great idea, but maple syrup also has some health benefits for your ear and hearing if you needed another excuse to have your maple syrup. All right, so of the 48 million Americans with hearing loss, 28 million could be helped by hearing aids. But in the group of hearing impaired Americans under the age of 70, less than 16% have ever used them. And in the over 70 group, still fewer than 30% have ever used them. Just so funny. You may have heard this. So why is that? What are the barriers to treatment? There's a number of reasons. Most everyone will tell you it's cost. And studies show that although 50% of people cite cost as an issue, it's not the real issue for that many. It is an issue for several. But the studies show that many people use that as their excuse. In the United Kingdom and in Norway, the use of hearing aids is at about 41%. And both of those countries have a system in which hearing aids are mostly provided to people through the public health system. In Switzerland, it's at about 38%, and in France, it's even less. It's at about 30% use. And in both Switzerland and France, people with a hearing loss can normally receive a subsidy that covers some or most of the cost of hearing aids. So surveys in the U.S. found that we're at about 24%. So while the use of hearing aids is higher in countries where there's better insurance coverage, it still only increases by about 15%. So they know that cost is not the issue, but it is the main excuse that's given for a lot of people. More than 2/3 of older hearing impaired patients that are non-users of hearing aids will say that my hearing is not bad enough or I can get along without one. Again, this is typically because hearing loss comes on so gradually that you're not aware that you have it. Your family has learned to accommodate for you. Your wife knows that if your head's inside the refrigerator, she's going to wait till you get out. The grandkids walk up behind you and say something and you don't hear it and they walk away and you don't know they were ever there. You don't know what you're missing for a lot of people. So it just gets by. They feel like they're getting by because they're not aware. I had a patient not that long ago, middle-aged guy with hearing loss in one ear, and didn't know he had it till he was going for a new job, a government job, and failed the hearing test. And they said, look, you want the job, you need a hearing aid, you have to pass the test. So he got the hearing aid for that reason only, really telling me I don't need it, but I'm going to wear it at work. So we saw him a couple weeks after for his checkup, and he was shocked. He couldn't believe what a difference it was making. He didn't have any idea that things that he was having trouble with in his life were related to the hearing aid and the hearing loss, really. His wife, as he said, was a social butterfly, and she liked to go out, and he was not enjoying it anymore. And he really felt like it was just his age. I'm getting the age, I prefer to be home, I don't like all that noise, I'm not a people person. And the day that I saw him, he said, we were out to dinner last night and I had a great time, and I realized it was because I could hear what was going on and participate in the conversation. So a lot of times the patients think they're doing fine, they think they're getting by fine, but they really are not aware of what they're not hearing. 1 in 5 people do say, wearing a hearing aid would make me feel old. I'm too embarrassed to wear one. And I hear that a lot. I had a woman recently who's in her 30s, and it took her a long time to wear the hearing aid. And she just kept saying, I'm not old. I'm like, you're not old. So clearly this is not an age problem. What I usually tell my patients is, when you're standing there smiling and nodding at a time when you shouldn't be smiling and nodding, when you're answering a question inappropriately, or you're completely withdrawn from the conversation, that's what I think makes you look old, not the hearing aid. But everybody has to come to terms with that. The other reason that patients give is, if I had a hearing loss, my doctor would tell me. The truth of the matter is, less than 16% of family doctors screen for hearing loss. And if any of you have been to the doctor lately, you know we're at a shortage of primary care physicians in this area. So they are overworked. There's signs often in offices that basically tell you you've got 15 minutes or 2 problems and that's it. If you're not discussing with them that you have trouble hearing, they're not probably going to ask about it. So you can't really wait for your doctor to tell you. You can't always wait for, if you don't have a problem, but it's your spouse or parent or friend that does, you often can't wait for them to recognize it either. Sometimes you have to be the nudge that they need to just have a hearing test and see where they're at. So why does it matter? You know, what happens if I have hearing loss and I don't do anything about it? Who's going to care? What difference does it make? Well, it's a use it or lose it phenomenon. We really hear with our brain. Your ear hears and sends the information onto the brain. The brain decides what you heard. Did you just hear the dog bark or the train? What did you hear? And how did you hear it? We hear with our brain. You know that it's true with any other muscle in the body. Use it or lose it. You've got to keep active. You've got to keep moving. If you are not developing that auditory pathway, you are losing it. We call this auditory deprivation, and I'm going to talk a little bit more detailed about this. So one of the main causes of untreated hearing loss is depression. Helen Keller, you know, was both blind and deaf, has a quote that we like. Blindness cuts us off from things, but deafness cuts us off from people. We see a lot of patients, and we get a med list, and there are several, I know it's an issue in Franklin County, who are on antidepressants. And we've tried to reach out to some of the local physicians and remind them that when they're seeing a patient with depression, they really should recommend a hearing test. A lot of patients with untreated hearing loss are starting to withdraw. It's very, very difficult to try to hear and participate in a group conversation or any place with background noise, or in a room like this, where it's reverberant, and so they stop going to things. They stop getting out and they stop participating, and that leads to social isolation and depression. So that's one of the biggest issues in our senior citizen population today in the U.S., and something that has long been linked to untreated hearing loss. Something that you may not be aware of, untreated hearing loss also leaves you at a greater risk for falling. People with just a mild hearing loss are 3 times as likely to suffer a fall or have a history of falling. And that increases the worse your hearing gets. Why is this a big deal? Well, falling is one of the leading reasons that people visit emergency rooms, that people are staying in rehab. 1 out of 3 adults fall yearly, and they're the leading cause of fatal and non-fatal injuries in the senior population. So why does this happen? Well, remember the diagram before I showed you your balance canals are in your inner ear? So they believe that sometimes whatever caused you to have the cochlear hearing loss also may be causing vestibular dysfunction. And another thought is that your hearing loss decreases the awareness of things around you, so you may not be aware as much, which leaves you at risk for falling. And it increases something we call your cognitive load, where when your brain is so overwhelmed with the task of hearing that it doesn't have enough energy left over to deal with the other things, like noticing a change in flooring, or etc. So untreated hearing loss, leaving you at risk for depression, for falls, income loss. According to a survey by the Better Hearing Institute, hearing loss negatively impacts household income on average of up to $12,000 per year. So we see this a lot. We do work in conjunction with the vocational rehab, which is a state department. They help patients, they help people get and maintain employment, and one of the ways that we work with them is if there is a person who's suffering from hearing loss and needs hearing aids, then they do have a program to help them acquire them, and we work with them for that. And the reason why that's so important is when your brain is working so hard to hear, you can't then be busy formulating a response and getting ready to do other things. So they find that hearing impaired workers who have untreated hearing loss have less performance, and which is why they're not being as rewarded as well, salary-wise. But also, it's exhausting. It's a lot of work when you have untreated hearing loss to try to hear and get by throughout the day. So they're petered out by the end of a work day. The big reason that's become very newsworthy in the last few years, and so this, I'm sure some of you may have seen this or heard about it, untreated hearing loss has been linked with dementia and Alzheimer's. I don't know if I want to get to this. So a man by the name of Dr. Lin at Johns Hopkins University has done some studies for years now, and they weren't initially looking at hearing loss. They were looking at Alzheimer's and dementia and trying to figure out what causes this. They looked, one study, they looked at over 600 subjects ranging in age from 36 to 90. None of them had any cognitive impairment at the beginning of the study. They were followed for 18 years. Some of them had hearing loss. And at the end of the study, they found that those with hearing loss that was untreated hearing loss, compared to individuals with normal hearing, had a 2, 3, and 5-fold increased risk of developing dementia over the course of the study. So it's related to the degree of their hearing loss. Mild untreated hearing loss gave them a 2 times greater risk, moderate loss a 3 times greater risk, and severe loss a 5 times greater risk of developing dementia and Alzheimer's. So they took out all other possible factors. They accounted for other things that we know cause dementia, aging, diabetes, hypertension. Accounting for all of that, this still stood true. So he got looking into more. How is this related more? Hearing loss and dementia. And they found a couple of things that I wanted to talk about today. So one of the reasons that he believes this happens is social isolation, as I mentioned earlier. As patients start to withdraw because they can't hear, they become socially isolated, depressed, and that's a leading cause of dementia. Another possibility is cognitive load. So what this means is when your brain has to work really hard at figuring out what the heck you're hearing, it doesn't have enough energy left over to do the other tasks. And the brain will actually, it's called cortical reorganization. It reorganizes itself to try to hear better. So it steals some of its higher end functioning to help with the hearing, which means it's not then available for the other cognitive tasks. And when they got looking at MRIs and scans, they could see it in the brain. This one just shows a brain with hearing loss compared to a brain with normal hearing. You can see the smaller section. There's actual atrophy or brain shrinkage in patients with untreated hearing loss. And it's occurring in the same area of the brain that Alzheimer's and dementia arises from. So he did another study. He looked at almost 2,000 adults, and the findings reinforced the earlier study that he did, even with this larger population, that there was a 30 to 40% faster rate of loss of cognition and memory abilities over just a 6-year period when compared with people who have normal hearing. And the worse the hearing loss, the worse their rate of cognitive decline. 2014, they did another study using the MRIs, and for 10 years they did an MRI every year, looking at the participants. There was over 100 participants, some with hearing loss, some without, and they found that those with even a mild hearing loss from the start displayed faster rates of brain shrinkage when compared to those with normal hearing. And as it says here, scientists reported more than an additional cubic centimeter of brain tissue lost each year in those with hearing loss compared to those with normal hearing. So this has been a big eye-opener in the healthcare world, although it's still sort of getting out there. But dementia and Alzheimer's is a huge problem, even here in Franklin County. It affects not just the patient, but it has a very big effect on the family. And anything that you may be able to do to prevent that, most people and physicians want to be aware of. So after they discovered all of this, Dr. Lin wanted to know, well, what if the patient treats their hearing loss? What if they wear hearing aids? Does that change anything? So in a study that they did find, where did I find it? Older adults with hearing loss that are using hearing aids perform significantly better on cognitive tests than those with similar hearing loss who do not use their hearing aids. I thought I had a better. Oh, here it is. So this was the study that he published most recently. The study found no difference in the rate of cognitive decline between a group of people that had no reported hearing loss and people with hearing loss but who used hearing aids. No difference in cognitive function. By contrast, the same group was compared with people who have hearing loss that don't treat it, and they were found to have significantly lower baseline scores on the mini mental state exam, which is a well-established test of cognitive function. So they did find that if you have hearing loss but you're treating it, your brain atrophy and your cognitive decline is no different than that of your normal hearing counterpart. So those are the biggest reasons that we have found why you should treat a hearing loss. It is more than just, I hear the TV fine, I get by, there's nothing to watch anyway. I just prefer to stay home, smaller groups. Sure, you could probably get by. It's more than hearing better. It's also treating to make sure that you are not going to suffer cognitive decline, not leave yourself more at risk for dementia and Alzheimer's, hopefully not suffer a fall, which can be very life-changing for a lot of patients. Well, this is just an example of some hearing aids. They've changed. A lot of people are hesitant. They've heard horror stories. They don't like what they hear. They know someone who has a hearing aid and it's in a drawer. I usually tell patients there's 3 good reasons why someone isn't going to like their hearing aids. One is technology. It changes tremendously. What we have today is nothing compared to what we had a few years ago. You know that about technology. I always reference my cell phone, but I can shop, watch movies, I can do all kinds of things on my cell phone. Does anyone remember the cell phone that came out 20 years ago, the big bag car phone? They're not even remotely similar. Neither are hearing aids. They have advanced tremendously. The second reason that some people are not going to do well with hearing aids is an individual or personal reason. It is work. When you've suffered for 7 to 10 years with some brain atrophy and auditory deprivation, you're not getting a hearing aid and walking out and everything's rosy. You're going to hear better right away, but you're also going to hear a lot of stuff that you're not used to, and your brain is not ready for it. It has reorganized to get used to the hearing loss. And it can take a good 6 months to sort of reorganize itself back to wearing a hearing aid. We do a lot of counseling and education with our patients so they kind of understand what's happening. I think that's a very important part. But it's tough for some patients. Some patients are impatient or they're not trustworthy. They don't have the faith that this is going to get better. Some patients have a very significant hearing loss. There are different degrees of hearing loss and different types of hearing loss. It's just like vision. Some people wear their glasses and they're fine. Some people have macular degeneration, so the glasses are not going to help them see well enough to drive at night. Some people with hearing loss have similar. They have such a diseased ear that the hearing aid helps them, but they don't do as well as others. So you really can't compare how well you're going to do with a hearing aid versus someone else you know. Very individual differences there. The third and biggest reason that I believe why some patients do better with their hearing aids than others is where you get it from. With all that I just talked about, you see that it's a brain process. I believe, should be a medical process that you go through with a medical professional. Unfortunately, in the state of Vermont, as in most states, to legally call yourself a hearing aid specialist and to sell hearing aids, you need only be 18 and purchase a business license. They don't even require a high school diploma. So many of the general public is not aware of that, and they're not doing well with their hearing aid, probably not a fault of the hearing aid at all. It's where they got it from. The person fitting it for them had sales training, but nothing else. Hearing aid today, as I said, is advanced tremendously in technology, but it's only as good as the person programming it. So if you buy a really expensive camera and you take it home and you have no idea how to use it, and so your pictures are all terrible, do you tell everyone you know not to get a camera because they don't work? We do that with hearing aids. They blame the hearing aid. And a lot of times it's not the hearing aid, it's how it was set up. So it's important to know your provider and what their qualifications are. So I wanted to talk a little bit about that. Why should you choose an audiologist? Like I said, education. Now we have to have our doctorate degree. When I graduated originally in 1996, it was a 6-year master's program. And then we had to do a clinical fellowship year, which is how I ended up in South Florida, because they're not easy to come by. They changed the degree by the early 2000s to an 8-year doctorate program. So you may see some older audiologists that didn't go back and get their doctorate. They were not forced to do that, but they weren't going to be given it either. I had to go back to school another 2 years to do that. Some chose not to. So there are still some older audiologists out there practicing with their masters. But nowadays it is a doctorate degree. When you think about the amount of time that someone has to spend in school to get their doctorate degree in audiology, there's obviously a certain amount of passion there. I like what I do. I find it enjoyable. I read my journal articles. I stay updated on what's happening in the field. It's not a job. It's a career. And I think that's a very important difference when you're seeking care from someone. I always tell our patients, do you want to be a patient or do you want to be a customer? Because there's a very different amount of care that you're going to get there. Because we're a medical professional, we're billing insurances. The dispensers are not. That's why they advertise free testing. Really what they're doing is a free screening for the sale of a hearing aid. You're not getting a medical evaluation. And that's something that's important to know, because we have seen patients who've never seen an audiologist, and turns out they had a medical issue with their hearing that was never addressed because they didn't get a full medical evaluation. Also, when you're getting a full medical evaluation, we're going to bill your insurance company. And because I'm doing that, that means I have lots of people overseeing me and auditing us and making sure that we are getting continuing education every year, following all kinds of codes of ethics. None of that is happening, with the sales places. And the other thing is, for Shannon and I, we live here in this community. So we see our patients at school, at the grocery store. We want to know that we've done everything that we can for them. It's our name on the door, at the end of the day. And I think that's true for a lot of audiologists. They're not working for Beltone or Miracle Ear, and if it doesn't go well, they're just, gone. So pay attention to where you're going. It's just a little quote. You do need to understand the price that you're paying for a discount when you see a sales place. And some of the studies have looked at this, and they've wanted to know, well, what really is the difference? Studies show when polled, a significantly greater percentage of people who receive hearing aids from audiologists report higher levels of satisfaction compared to those who receive their aids from dispensers. More folks who purchase their aids from hearing instrument specialists express dissatisfaction than those who obtained their aids from an audiologist. And in a related question, people were asked if they would recommend their hearing aid dispenser to friends or relatives. More people who saw an audiologist said yes, compared to those who saw hearing instrument specialists. So hearing aids have come a long way. They are just a device. What you need is someone who knows how to program it and to walk you through these months of brain reorganization until you get used to it. So your provider is very important. And I don't think that it's a well enough known fact in the state of Vermont what the difference is. A lot of the times at the sales places, they've got lots of framed certificates on the wall and they're wearing a white lab coat, and people just assume because they're going to treat a hearing problem that they're seeing a medical professional, and that's just not the case. So be aware of where you're seeking services. The other thing is just to make it something that you do. You get your eyes tested annually, your teeth cleaned twice a year. Why haven't you had a hearing test? Nothing to be afraid of, it's painless. Our booth is not that small, so even if you're claustrophobic, it's not a problem for people. It's really just listening to some beeps and pressing a button. It's not hard.